you've said that this administration is not strong as they try to look. They have weak spots. Can you speak on it? What have you observed? I do think that this administration is a lot weaker than they like to portray. It's hard because even the news doesn't report on this. And as we've seen, CBS just got taken over by some right-wing person that has like a very thin resume. And like all these news organizations are getting like sued, or we saw what happened with Jimmy Kimmel. And so we saw ABC News with this, or I believe it was also CBS, I believe, with the settlement that with the administration that was like pretty, let's just say didn't really have grounding. And so increasingly this administration's losses are not being as reported on. But very often they do have to reverse course. They will make this big announcement that they're going to do something, for example, such as with the National Guard in Los Angeles or California earlier this year. Like what they do, they have this pattern of coming out very aggressively, and then people react to that aggressive announcement. But when it's time for them to actually follow up, they are not able to follow up, or they have to reverse course. But what people remember is the aggressive announcement instead of the reverse in course. And so like I would say the National Guard is an example of that in California, where they are trying to do this big thing for reaction, but they often have to retreat afterwards. And even now, they passed in May $1 trillion in healthcare cuts. And this is going to be devastating for us. I want to be very clear about that. I think that they passed this really thinking that Medicaid, like I pulled a Republican aside on the floor and I said, hey man, there's no cameras around here. Like, I just want to understand. Like, I'm not here to put you on blast in front of a camera, just person to person. I genuinely want to understand, because I do. Like, people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. Anyways, that's a whole other conversation. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. Like, I just want to know from your perspective. I'm not trying to win you over. I'm not trying to put you on the spot, but I just want to know from your perspective, are you worried about that? Or like, what are you thinking about with your hospitals and your people? Because a lot of people don't know, like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to, like, make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, like, okay, like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. Good to know. Like, good. That is an important thing to know, right? What a person responds to. And so so anyways, they didn't believe a lot of these warnings about Medicaid and the effects on hospitals when they passed this bill. So they passed the bill thinking that it's all political chit chat. And then after they passed this bill, a lot of their hospitals were like, there was one hospital in one of these districts that was like, yeah, we might have to close. And they are now on their back foot. Like, they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking. Because Donald Trump himself posted on Truth Social months ago being like, Medicaid's not going to be touched. Medicaid's not going to be touched. Well, promises made, promises broken. And I'm sure that many of you may be hearing from people that maybe voted for Donald Trump in November and are like, I didn't think it was going to be like this. And as much as one can feel however one feels about this, the fact of the matter is these people are sensitive to political reality. They are sensitive to polls. They are sensitive to these things. And I think they are very frightened. That's why they don't want us talking about healthcare. They don't want us talking about Medicaid. They don't want us. I mean, if you just post, you want to talk about something that you can do. Here's a great thing that you can do. These healthcare notices are going out. They started getting finalized October 1st. I believe in California, they will be hitting your inboxes on October 15th. Across the country, every state in the country has a different day. Like the premium changes kind of got decided on October 1st, and they're getting mailed out throughout the month in the country. When you receive your premium change, post it. Post it online. I'm so serious about this right now. Post your premium change online. Say, I just got notification, or there were some people that were DMing me. I work at an insurance company and this is the change that we're seeing for people. Or like, I just got my notice in the mail of my premium. This is what it was. And this is what they're telling me it is later. And it is very important for you to share that, because we live in such a polarized political environment and in such a polarized information environment that if someone says something, even if they cite studies, someone else will just automatically not believe them because they have a D or an R next to their name, right? And so this isn't just about citing studies. Citing studies, I think, is important when you are talking to people that are listening, right? When we are talking to one another, when I'm telling you about the fact that some of the Yale studies that Bernie and I mentioned in our video indicate that 50,000 Americans are going to die from being uninsured if all of these cuts pass as is per year, like that is something that you may, if you are already listening to me, you will hear me say that. But you as individual people have a tremendous amount of power when you post your life. And so when you get that notice in the mail, post it. Post it, because your premiums skyrocketing and the cost of your healthcare skyrocketing, and this is going to affect everybody. It doesn't matter if you have Medicaid, ACA, standard insurance, it's all getting so much more expensive because they backed up $1 trillion of healthcare funding out of the system. And when you cut $1 trillion out of our healthcare system, then that gets made up by jacking up prices on on middle class people, on upper middle class people, on lower class people. Everybody's getting hit by this. Whether you have Medicaid, you're paying more. If you have standard private insurance, you're paying more. If you have ACA, you're paying more, because we just vacuumed out $1 trillion of infrastructure from our healthcare system. And so there's no escaping that reality. And so when you see your premium go up, post it and say, like, thank you, like this Republican House, Senate, whatever, for these cuts. Or you just point to the healthcare cuts, because someone out there may not believe me when I say something, simply because they have certain thoughts about me, or they don't like the political party that I'm a part of, or whatever it is. But they will listen to you. They will believe you. When you post that screenshot, it is far more compelling than talking about some damn Yale study. And I love the public health students at Yale, but we know certain things, and that information is important. It is critical. It informs policy and lawmaking, but political persuasion is also a different category. And so we need to rely on science and the scientists and everything to inform many of our decisions. But in terms of who the people that are open to being persuaded need, they need to hear it from you. They need to hear it from people out and around them, because community and that echo sound is incredibly important. So doing that, let me see what else we've got here.